femoral neck fractures. It is a comparison study. So in elderly population, femoral neck fractures are the most common fractures, occurring up to 19 to 41%, and it is described as the beginning of an end for an elderly person. So the estimated femoral neck fractures was 1.66 million worldwide in the year 1990, which is estimated to reach up to 6.26 million in 2050. So bipolar prosthesis, it has a theoretical advantage of translating the weight to the inner bearing of the prosthesis, which then reduces the prosthesis acetabulum interface, which then reduces the acetabulum erosion. So for these fractures, the treatment goals are swift recovery, early return to pre-operative functional outcome, functional status, and minimizing the post-operative mortality and morbidity, and of course to decrease the need of revision surgery. So due to the high cost of bipolar implant and the procedure, which is technically more demanding than Austin Moore prosthesis, it is significant that the functional outcome has to be statistically significant so that the above mentioned can be overseen. So the objective of our study is to compare the midterm survivorship and functional outcome of Austin Moore prosthesis and bipolar hemiarthroplasty in patients with femoral neck fractures. So it is a retrospective study which was conducted for 5 years, midterm, 2012 to 2016, in Department of Orthopedic Surgery in Liaquat National Hospital. So total in our Austin Moore group, we had 198 patients, and in our bipolar group, we had 173 patients, out of which 116 responded, 80 expired, and 36 remained. In hemiarthroplasty group, 77 patients responded, out of which 37 expired and 40 were left. So as per gender, there were obviously female predomination, and most of the patients were in ASA class 2, and a limb was mostly right involved, and patients mostly had multiple comorbs as they were old. So besides the prosthesis, both groups were treated with the same protocol, and lateral Hardinge approach was used, spinal anesthesia was used, and pre-induction antibiotic was given. And post-operatively, patient was started full weight bearing mobilization as tolerated from the next day. So in bipolar group, 70% of the patients, they returned to pre-ambulatory status, which was independent community ambulatory. And in Austin Moore group, only 33% of the patients returned. So there was a significant difference in the operating time and estimated blood loss in between Austin Moore and bipolar, and was significantly low in Austin Moore group. So now, because my article states survivorship, so survival analysis, it is a collection of statistical procedure for data analysis where the outcome of variable interest is time until an event occurs. So in our study, that point is ambulatory, independent ambulatory status. So this is the Kaplan-Meier curve, which shows there is significant line, which the blue line denotes the bipolar and the red line denotes
1 minute remaining.
The red line denotes Austin Moore prosthesis. So first endpoint so that overall our result was patient returned to pre-ambulatory status in 5 weeks in bipolar and in 7 weeks in Austin Moore prosthesis, which was also statistically significant. So our result shows that in elderly patient with displaced femoral neck fractures, bipolar offers a better range of movement with less pain, more stability, and early return to the pre-ambulatory status than Austin Moore prosthesis, despite Austin Moore prosthesis, which is low cost and also gives less operating time and less blood loss. So it was a retrospective study, which was a limitation, and there was no algorithm used in choosing the implant for the patients. A large sample size, along with better patient selection and long-term follow-up, approximately 10 years, is required to compare for the comparison of complication rates such as aseptic loosening, acetabular protrusion in both groups, as they are likely to escalate in the long term. Thank you.
Right. Our next speaker is Dr. Shahzeb Riaz from Ziauddin Hospital, and his topic is complex hip arthroplasty following failed proximal femur osteosynthesis, our experience.
Assalamu alaikum and good morning to everybody. My name is Dr. Shahazeb Riaz. I'm from Ziauddin University Clifton campus. The topic I'm going to be presenting is complex hip arthroplasty following a failed proximal femur osteocentesis. So hip fractures, a fracture is a common orthopedic pathology, especially in the elderly, and at times challenging to deal with. They can cause serious morbidity, functional impairment, and the main objective of the surgical treatment of these fractures are pain alleviation and restoration of function. However, even with advanced surgical implants and techniques, problems like non-union and implant failure still pose a potential threat for surgical treatment. Failed hip osteocentesis frequently demands revision surgery. So the common causes are inadequate reduction, poor fracture stability, implant failure, poor bone quality, delayed presentation. The pros are pain alleviation and improved functional outcomes. Cons are longer recovery time. It's not working. So this is time to stop.
Sorry, can we stop the time? It's not working.
It's working. So the study design was a retrospective observational study, and it was conducted at Ziauddin University Hospital, Clifton campus, with a sample size of only 32. It was a 5-year duration patients were taken. I'm so sorry it's not working this now. There's something wrong. ये नहीं चल रहा.
You can read it from there, all right?
I can, but फिर से restart तो नहीं होगा. I hope the time is being managed. I'm so sorry. So the pros are, we've already discussed that. So the selection of a suitable prosthesis and an effective surgical strategy influences the treatment outcome. So our objective was to report our experience with complex hip replacements after failed osteocentesis for proximal femoral fractures, and was to assess the functional outcomes and complications. It was a retrospective observational study for 5 years, 32 sample size, conducted at Ziauddin University Hospital. So patients who were included, who had had a proximal femoral fracture and undergone orthoplasty, either with a DHS, PFN, or reconstruction nail, and had at least 1 year of follow-up. So patients who were excluded from were the ones with the missing data, missing medical records, lost to follow-up, patients with cognitive impairment, and re-revision surgeries as well. Demographics were collected, and surgical records, which included that the time elapsed, surgical technique, implant, and cause of failure of the index surgery. Clinical evaluation was done using a VAS and Harris Hip score, and the radiographs were checked for implant positioning, signs of non-union loosening, and signs of infection. So the complications which were noted were infection, DVT, dislocation, intraoperative fractures, and periprosthetic loosening. SPSS 24 with a significant 0.05 was considered significant. So when we assessed our results, the Gruen criteria was assessed for the radiographs, where we saw that there was no signs of any loosening at 1 year, and no mortalities were reported at 1 year. Most of our patients were in the female side, were about 62%. The primary diagnosis at the index surgery were 19 of them were intertrochanteric and 13 were subtrochanteric. The reason of failure of these osteosynthesis were mainly cutouts, which were 19 and 13 for a non-union. And the functional
1 minute
Harris
remaining.
hip score was that at 1 year there was a 20 were poor and 12 were fair, and 25 were good after 1 year of post-op. And the implant relation when checked was modular Wagner was used, and when comparison VAS score was significant with 1.4 post-op 1 year. So these are some of our x-rays where we can see that how we have managed them, but because of the lack of time, I'm running through these x-rays. So discussion: complex hip arthroplasty is a successful procedure, effective, reduce and restore hip function. And VAS was significant. Limitations to this study was that it was a retrospective, single-center study, 1 year follow-up, and sample size was relatively small. So conclusion, our study undergoes that the efficacy of hip arthroplasty as a viable intervention followed failed femur osteosynthesis. It demonstrates improved functional outcomes and enhanced quality of life. Thank you.